Hey, it's Dr. Murphy. Today we're going to talk about the menstrual cycle. I want to help you distinguish what's normal and what's not so normal. So the menstrual cycle is a normal part of development if you were born female with a uterus. There's 4 different phases of the menstrual cycle. So it lasts about 28 days on average, but we're going to talk about the period, which is the first 7 days of that menstrual cycle. So the period is when you're bleeding because the uterine lining is shedding. And then after the period is done, you have 3 more weeks of the cycle where you're not bleeding. So that repeats every month as long as you're not pregnant. So you have your period for 7 days. You don't have any bleeding for 3 weeks. That's the time your body is getting ready for a pregnancy. And if you don't get pregnant, you have a period the next month. And that cycle continues until you reach menopause, which is typically around mid-40s, early 50s. Your menstrual cycle starts usually between age 10 and 15. So sometimes it can be a little bit earlier, a little bit late. But if you haven't started by age 15, you need to talk with your doctor about that to see if something could be wrong. So now we'll talk about what's a normal cycle and what's not so normal. But before we do, I want to remind you, go like and subscribe to my channel. So for a normal cycle, it usually lasts 3 to 7 days. You can have heavy bleeding the first day that lightens up, or it can just be light the whole time. You may have the mild cramping that gets better with like a heat pad, or you can take over-the-counter medicine like Tylenol, ibuprofen, Midol, and you'll get some relief. And then after the period is over, you're, back to normal. But if you have severe cramping that does not respond to a heat pad or over-the-counter medicines, that may be your first sign that something is abnormal. So the severity of the cramping can help you distinguish normal from abnormal. The second thing we look at is how heavy are you bleeding? So normally, if you use a tampon or a pad, you can go several hours in between needing to change it with a normal amount of bleeding. But for people who bleed heavy, they may have to change their tampon or pad every 1 or 2 hours, and that can go on for hours and for days. They may pass large clots that's bigger than like quarter size, or they may have to wear both a tampon and a pad because of how quickly they soak. So if that's happening, you're probably on the heavier side of bleeding, and that would be a concern that you would want to talk with your doctor about. And some people who've had periods for several months and years that have been heavy will develop iron deficiency anemia. So that's when you may feel tired, you may feel short of breath or dizzy. You may have palpitations where your heart's racing, especially when you're changing positions. You can have pica. That's where you're craving things that are not food, like ice, dirt, chalk. So if you're having those signs of iron deficiency anemia, you need to talk with your doctor because more than likely your heavy cycles can be contributing to it. And the last thing that can help you distinguish between normal and abnormal is how often are you bleeding? So normally you would just bleed that 3 to 7 days at the beginning of the cycle and not see bleeding again until the next month. If you're someone who's bleeding in between your cycles, your normal cycles, or if you're not bleeding every month, then those are signs that something's not right. You're bleeding too often or not enough. So that could be a clue that something's wrong. So if you have severe cramping, heavy bleeding, or irregular timing of your bleeding, then those would be cause for concern for you to let your doctor know. Don't necessarily wait for your physical. You can schedule an acute visit where you come in with that concern and they'll talk with you, ask you more questions to kind of figure out if it's something else that could be causing it. Because if you changed your diet, or if you're doing a new exercise plan, or if you've recently lost or gained weight, if you're stressed, all of those things can affect your period. So they'll talk with you about those things. And if they can't identify something based on the history, they may want to do an exam and do some swabs, make sure there's no infection. They may collect blood work, looking at your hormones like your thyroid. They may do some procedures or some imaging like an ultrasound. So that can help them look at other causes like fibroids, endometriosis. I mentioned the hormones. There are some medicine side effects that can cause it. So there's a lot of things that can contribute to an abnormal cycle. So don't brush it off. Talk with your doctor about it and share this information with others, your friends, family, classmates. There's many people who don't really know the difference between normal and abnormal. So share this with them. And if you have other symptoms or signs that we hadn't talked about today, feel free to leave them in the comments so that other people can read those. All right. Thank you.